check your TSH from before you started on thyroid hormone. Once you're on hormone, you can't assess this, right? You can assess if your hormone levels are, if your medication dose is high enough to get you to the normal range, but you can't assess your endogenous output, right? So if you can get the labs from before you were diagnosed and those labs before you started on hormone showed a TSH between 7 and 10, and you're now on hormone, consider getting a second opinion. Said another way, if you were a little bit unclear in your diagnosis, get a second opinion. And consider using selenium and myoinositol if your TSH is between 7 and 10, because like we talked about, that can improve the odds of getting back to normal, even though being in that range isn't necessarily a cause for intervention. Check your TPO antibodies. If under 500, consider this a clinical win and your hypothyroid risk is low. You can still consider improving your diet and getting more dietary selenium and myoinositol, supplementing with vitamin D with selenium and with myoinositol, but these things are not urgent. They're not necessarily needed. And the final point here, even though this may expose me to some slings and arrows, if you were diagnosed by an integrative doctor, someone who is not practicing in the conventional model, then I would consider getting a second opinion. And this is not to disparage any provider. I think we're all trying to help. Unfortunately, in the camp of integrative functional alternative medicine, the TSH is rampantly misinterpreted, and the TPO is also very commonly misinterpreted. On the other side of the coin, oftentimes a conventional provider might be a little bit lackluster in terms of dietary and nutritional recommendations for your thyroid health. However, they're not incorrectly diagnosing the TSH and the TPO unless they're conventional, but now practicing in an integrative anti-aging sort of model.